3,063 lawsuits, stomach paralysis that won't go away, vision loss that happened overnight, hair falling out in clumps. These aren't horror stories from some fringe medication. This is Ozempic, the weight loss drug everyone's talking about, the one celebrities won't admit they're using, the one your doctor might be prescribing right now. But here's what nobody's discussing, not the commercials, not the Instagram influencers, not even most doctors, the side effects that are landing people in courtrooms, emergency rooms, and permanent disability. Stay with me for the next 13 minutes, because what you're about to learn could change everything you thought you knew about GLP-1 medications. I'm here to share insights from Dr. Rocio Salas-Whalen, and before you click away thinking this is another anti-Ozempic fear-mongering video, hear me out. Dr. Salas-Whalen is triple board certified in endocrinology, obesity medicine, and internal medicine. She's been prescribing GLP-1 medications longer than most doctors even knew they existed. She's a guest expert on Dr. Mike's podcast, Mel Robbins' show, and she just published her book Weightless in December 2025. Here's what makes her different. She's openly pro-Ozempic. Controversial, I know, but she's also brutally honest about the risks. Her philosophy? You deserve the complete truth. Every statistic, every lawsuit, every side effect, because informed consent isn't optional. It's your right as a patient. Now, quick legal disclaimer. This video is for educational purposes only. This is not medical advice. Always consult your healthcare provider before starting or stopping any medication. We're here to inform, not prescribe. So let's talk about what's really happening with Ozempic. The good, the bad, and the 3,000 lawsuits. Here's where Dr. Salas-Whalen stands and why her position matters. She believes obesity is a disease, not a character flaw. And like any disease, it requires medical treatment. In her book Weightless, she writes that GLP-1 medications like Ozempic represent the biggest breakthrough in obesity medicine in 50 years. She's seen patients reverse diabetes, avoid heart attacks, and reclaim their lives. But here's the part that makes her controversial in medical circles. She refuses to sugarcoat the risks. While other physicians might downplay side effects to encourage compliance, Dr. Salas-Whalen does the opposite. She requires every single patient to undergo comprehensive testing before starting treatment. Eye exams, kidney function, thyroid screening, family history deep dives. Why? Because she's seen the complications. She's treated the gastroparesis cases. She's had patients call her panicked about vision changes, and she knows something that pharmaceutical companies would rather you didn't think about too hard. These drugs are powerful, life-changing for many, devastating for some. And we're still learning who falls into which category. Her take? The benefits outweigh the risks for most patients. But that equation only works if you actually know the risks you're accepting. So let's examine what those risks actually are. Let's start with the one that's driving most of those 3,063 lawsuits. Gastroparesis, medical term for stomach paralysis. And yes, I mean actual paralysis. Here's how Ozempic works for weight loss. It mimics a hormone called GLP-1 that slows down your digestion. You feel full longer, you eat less, you lose weight. Simple, right? Except in 8.9% of patients, something goes terribly wrong. Their stomachs don't just slow down, they stop working properly. And for some people, this doesn't reverse when they stop the medication. Dr. Salas-Whalen has seen patients vomiting 20-30 times a day, unable to keep down water, losing dangerous amounts of weight, but not in a good way, malnourished despite eating. Some require feeding tubes, others end up on disability because they literally cannot function. One of her patients described it like this: I wanted to lose 30 pounds. Instead, I lost my ability to eat. I lost my job because I couldn't stop throwing up. I lost my social life because I can't go to restaurants. All of that for 30 pounds that I've now lost anyway because I'm starving, but not by choice. That's lawsuit territory, failure to warn. Because nowhere in the cheerful Ozempic commercials do you see someone doubled over a toilet bowl. Now here's what shocked even Dr. Salas-Whalen when the research came out. Vision loss, specifically something called NAION. Non-arteritic anterior ischemic optic neuropathy. What that means in plain English, the blood supply to your optic nerve gets cut off. You go to bed, seeing fine. You wake up, and part of your vision is just gone. A July 2024 study published in JAMA Ophthalmology found that people taking semaglutide, that's the drug name for Ozempic, had a 4 to 7 times higher risk of developing NAION compared to people not taking it. And here's the terrifying part. There's no treatment, no surgery, no medication. What's gone is gone permanently. Dr. Salas-Whalen now requires all her patients to get dilated eye exams before starting GLP-1 therapy, and every 6 months while taking it. She explains it to patients this way: we don't fully understand the mechanism yet. We think it has to do with blood flow changes. What we do know is the risk is real. It's measurable. And if you have pre-existing eye conditions like glaucoma or diabetic retinopathy, your risk goes up even more. One patient, a 58-year-old teacher, lost vision in her right eye after just 4 months on Ozempic. She's now part of a class action lawsuit. Her lawyer told reporters she was never informed this was even a possibility. She thought the worst that could happen was nausea. But wait until you hear this next part, because it's actually on a label, and most people still don't know about it. The FDA's black box warning. That's their highest level of alarm, and it's right there on Ozempic's packaging. Thyroid tumors, thyroid cancer. In animal studies, rats and mice given semaglutide developed thyroid C-cell tumors. Some were malignant. Now, does this translate to humans? We don't have 20 or 30-year longitudinal data yet. These medications haven't been widely prescribed long enough, but the FDA considered the animal data serious enough to mandate the warning. Dr. Salas-Whalen is crystal clear on this point. If you have a personal or family history of medullary thyroid carcinoma, or a rare condition called multiple endocrine neoplasia syndrome type 2, she will not prescribe GLP-1 medications. The risk isn't theoretical. It's documented in animal models, and ethically, we cannot gamble with your thyroid. Warning signs she tells patients to watch for: any lump in your neck, hoarseness that doesn't go away, difficulty swallowing, persistent shortness of breath. If any of those appear, stop the medication immediately and get imaging done. Now let's talk about your kidneys, because this one's more common than people realize. Acute kidney injury. According to FDA adverse event reports between 2018 and 2024, there were 2,375 cases of acute kidney injury linked to GLP-1 drugs. How does this happen? The chain of events goes like this. You start Ozempic. You experience nausea and vomiting. That's actually extremely common, affecting about 20% of users. You're throwing up multiple times a day. You get severely dehydrated. Dehydration stresses your kidneys. In vulnerable patients, older adults, people with pre-existing kidney issues, diabetics, this can tip into acute kidney failure. Dr. Salas-Whalen has a hard rule for her patients. If you're vomiting more than twice in 24 hours, you call her office immediately. You don't push through. You don't wait it out, because kidney damage can become permanent if it's severe enough or goes untreated too long. Red flags to never ignore: dramatically decreased urination, swelling in your legs or ankles, extreme fatigue that feels different from normal tiredness, and confusion or brain fog. Those are signs your kidneys are struggling, and you need medical attention now. And then there's the side effect that won't kill you but devastates people emotionally: hair loss. About 3% of Ozempic patients experience significant hair thinning or shedding. Clumps in the shower drain, thinning at the crown, receding at the temples. For many women especially, this becomes the breaking point that makes them quit the medication. Why does it happen? Rapid weight loss puts your body into stress mode. Physiologically, your body thinks you're starving, and when resources are scarce, hair follicles are expendable. Your body redirects protein and nutrients to vital organs and away from cosmetic features like hair. Add to that the fact that many Ozempic users aren't eating enough protein because their appetite is so suppressed, and you've got a recipe for telogen effluvium. That's the medical term for stress-induced hair loss. Is it permanent? Usually not. But Dr. Salas-Whalen warns patients it can take 6 to 12 months to regrow after stopping the medication. And for some patients, the shedding continues even after discontinuation, which suggests there might be more going on than just rapid weight loss. So why is all this happening? Let's talk about the science behind GLP-1 medications, because understanding the mechanism helps you understand the risks. GLP-1 stands for glucagon-like peptide 1. It's a hormone your body naturally produces in your intestines after you eat. It does several things. It signals your pancreas to release insulin. It tells your liver to stop dumping glucose into your bloodstream. It slows down how fast your stomach empties. And it signals your brain that you're full. Ozempic is synthetic semaglutide, a molecule that mimics natural GLP-1 but lasts much longer in your system. Instead of breaking down in minutes like your natural GLP-1, semaglutide hangs around for days. That's why it's a once-weekly injection instead of something you'd have to take with every meal. But here's where things get complicated. GLP-1 receptors aren't just in your stomach and pancreas. They're scattered throughout your body, your eyes, your kidneys, your thyroid, your brain, and when you flood your system with synthetic GLP-1 at doses much higher than your body would ever naturally produce, you're activating all those receptors in ways we're still studying. Pause 1 second. That's why you get effects beyond blood sugar control and weight loss. The vision issues? Likely related to GLP-1 receptors in the blood vessels feeding your optic nerve. The gastroparesis? Overstimulation of receptors that control stomach motility. The thyroid concerns. Animal studies suggest GLP-1 affects C-cell proliferation. Dr. Salas-Whalen explains it to patients this way. These medications are incredibly effective because they're so powerful, but that power is not surgically precise. It's more like flooding your entire system and hoping the benefits outweigh the unintended consequences. For most patients, they do. Blood sugar normalizes, weight drops, cardiovascular risk plummets. But for that 8.9% with gastroparesis or the patients who lose vision or develop kidney issues, the calculation looks very different in retrospect. So what would Dr. Salas-Whalen tell you to do if you're considering Ozempic or already taking it? First, demand comprehensive baseline testing before you start, not just a quick prescription at a weight loss clinic. You need a dilated eye exam by an ophthalmologist. You need kidney function tests, creatinine, and GFR numbers. You need thyroid screening, especially a check for thyroid nodules, and your doctor needs to review your complete family medical history. If they're not doing this, find a different provider. Second, start at the lowest possible dose and increase slowly. Dr. Salas-Whalen sees too many patients who jump to